and milestones. Okay, here you see the first question. Modern concept of pediatric is. Modern concept of pediatric is, or the aim of the subject pediatric is to give continuous care to the child, and not only that, to provide preventive care to the children. The next second question, part of brain that controls and integrates activities of autonomic nervous system in children. Part of brain that controls and integrates activities of autonomic nervous system. And the answer is hypothalamus. Then third question, at which age child help in household chores, dresses and undress? At which age child helps in household chores, dresses and undresses activities? At 5 years. At 5 years of age, child helps in household chores, dress and undresses activities. The next one, in development of language, a child tells stories by the age of. In development of a language, a child tells a story by the age of. At 4 years of age, the child develops language as well as the child able to tell the stories. The next one, next question, low reoccurrence in nocturnal enuresis is seen with which of the following? Low reoccurrence in nocturnal enuresis is seen with which of the following activity? And the answer is bed alarm. So bed alarm has a best success rate is seen with bed child in seen in child who has the problem nocturnal enuresis, and by this activity the child should get up and go to the toilet without fail. The next question, early strict toileting can result in which of the following condition? Early strict toileting can result in which of the following condition? And the answer is night terror. The next question, which of the following milestone is a red flag sign in child development if not attained? Which of the following milestone is a red flag sign in child development if not attained? The answer is social smile at 3 months. The next one, the most common cause of short stature in the child. The most common cause of short stature in the child. Constitutional development delay is the most common cause of short stature in the child. Here you see the meaning of night terror. So the night terror is a screaming or crying at night time during sleep, and this night terror mainly we can see at the toddler age or in young child. The next one, height of child less than third percentile or less than 22 st. Height of the child less than third percentile or 2 st of mean height is called short stature. Then taste perception of a child develop at taste perception of child develop at birth. Then Asperger's syndrome is a which delay? Asperger's syndrome is a developmental delay. The next one, DAS is a developmental disorder affecting child ability to effectively socialize and communicate. Okay, this Asperger's syndrome is nothing but is a development disorder affecting child ability to socialize and to communicate. The next one, during first year after birth, an infant birth weight normally. During first year after birth, an infant birth weight normally triples. Okay, here you see the expected weight of next question. The expected weight of 1 year old child when birth weight is 3.5 kg. So at 1 year, the weight of the birth baby triples. So the answer is 3.5 into 3, that is 10.5 kg. Then here you see the child weight increases according to age. So at birth, the weight of the baby is 3.5 kg, and at 5 months, and at 5 months, the weight of the baby doubles. At 1 year, it triples, and at 2 years, it increases 4 times, and at 3 years, it increases 5 times, and at 5 years, it increases 6 times, and at 7 years, it increases 7 times, and at 10 years, it increases 10 times. So this is about the child weight according to their age. The next question: child grows an average of dash inches per year. Child grows an average of dash inches per year, and the answer is 2 inches per year, that is 5.2 centimeter. The next one, the growth chart is used for. The growth chart is used for growth monitoring, diagnostics. It acts as a diagnostics tool, and not only that, it is also act for action. The next, growth chart is also known as road to health chart. The normal weight of the Indian child is 2.5 to 3.5 kg. Then baby weight at 5 to 6 months of age. Baby weight at 5 to 6 months of age. And the answer is the baby weight doubles at 5 to 6 months of age. Already we have discussed here. Okay, the next question. The normal chest circumference of newborn 31 to 33 centimeters. Then next out, newborn lose dash percent weight in the first 4 to 5 days. That is 10%. Then after birth, the last weight, that is 10%. Again the baby regain it by 10 to 12 days of age. Then 5% loss on day of birth is considered as normal or not? Yes, it's considered as normal. So the 5% loss of uh, weight is a normal milestone. And next question, the length of the baby at the birth is approximately 45 to 51 centimeter. Then length of the baby doubles at dash years of age, at 4 years. The next question, height of the child will increases till the closure of epiphyseal plate. Then in a healthy child, the head and chest circumference will become equal at 12 months of age. The next question, at birth, head circumference and chest circumference is about. The head circumference 33 to 35 centimeters, chest circumference 30 to 33 centimeters, and this chest circumference as well as head circumference become equal at 12 months of age, 9 to 12 months of age. Then in healthy child, the head and chest circumference equal around the age of 9 to 12 months of age. The next question, normal head circumference of newborn 33 to 35 centimeter. The normal mid upper arm circumference at birth is about 9 to 11 centimeter. The best method to perform physical examination on 2-year-old child is from least to most intrusive. Then head control is expected at the age of 3 months of age, and head lagging in 6 months. At 6 months, need attention. And next one, the maximum absolute growth seen at 13 years at girls and 12 years in boys. And 13 to 18 years, sorry, 8 to 13 years, we can see maximum growth in girls, and 10 to at 10 to 15 years, you can see maximum growth in boys. Then next one, the infant with birth weight 2 kg considered as a high risk infant. Infant with birth weight 2 kg considered as high risk infant. So the normal weight of the baby already we have discussed 2.5 to 3.5 kg. So if the baby with 2 kg considered as high risk infant, then premature closure of sagittal suture called scaphocephaly. Scaphocephaly is a type of cephalic disorder which is characterized by premature fusion of sagittal suture. Premature closure of coronal suture called oxycephaly. Premature closure of lambdoid and coronal suture called acrocephaly. Flattening of one side of skull called phagocephaly. Absence of a major portion of skull called encephaly. The next question, the average length of the normal newborn baby is 50 centimeter. The normal manifestations of newborn. So these are all the normal characteristics we can see in the newborn: uneven head shape, irregular respiratory rate, and positive motor reflex. And heart rate 80 beats per minute is not considered as normal manifestation. Then microsomia means baby with large head, and anterior frontale closed at 18 months of age, posterior frontale closed at the between 6 to 8 weeks of age, that is 1.5 month to 2 months. The next question, anterior frontale known as bregma, posterior frontale known as lambda, and how much a neonate should gain weight after successful feeding, that is 25 to 30 grams per day. Then mid-arm circumference value in moderately malnourished child is less than 11.5 centimeters, less than 12.5 centimeter, 13.5 centimeter, less than 14 centimeters. Give your answer in comment box. The next question, milestone typically achieved by infant around 9 months of age is crawling. Following milestone typically achieved by a newborn with the first month of life, lifting and turning the head. Then a male baby will be having optimal 15 percentile head circumference at 45 centimeters at the dash age, that is 9 months. So according to WHO, boys head circumference 45 centimeters at 9 months and 46 centimeters at 12 months. Then brain growth is maximum during infancy. The next question, a child like to look at itself in a mirror at the age of 6 months. Then a 3-year-old child cannot draw a square, and the child able to draw a square approximately 4.5 years of age. Thank you.